Did you know that it takes an average of 4.5 years to get diagnosed with an autoimmune condition? That's almost the length that it takes to get a medical degree. Hi, I'm Dr. Anindita Santosa. I'm a rheumatologist practicing at Aaria Rheumatology. Let's start by discussing what autoimmune conditions actually are. Autoimmune conditions are conditions where your immune system, that's your elite security system, decides to turn against your own body and attacks your own tissues. This results in inflammation and various different symptoms. There are actually more than 80 types of autoimmune conditions. You may have heard about things like lupus, rheumatoid arthritis, type 1 diabetes mellitus. Fun fact! Autoimmune conditions are more common in women. For example, lupus is 10 times as more common in women than men, and rheumatoid arthritis is 5 times as more common in women than men as well. And why is that? The reason is that 1. Many of the symptoms of autoimmune conditions are often vague. Patients may report symptoms like body aches, tiredness, things that actually many of us feel after a very long week. So often, patients dismiss the symptoms until things become much worse. Furthermore, autoimmune conditions are very, very rare, and therefore, unless the index of suspicion is high, for example, if you already have a family history of autoimmune conditions, many doctors may not attribute your symptoms to autoimmune conditions. So how do we then know whether you have an autoimmune condition? I suppose one of the things is, of course, your symptoms, your signs. Do you have any rashes, any swollen joints? There are blood tests that we can perform, but these are not foolproof. Sometimes autoimmune tests may come back positive, but if you're completely asymptomatic, that does not mean you have an autoimmune condition. Conversely, your tests may come back negative, but you have significant symptoms, and you may still very well have an autoimmune condition that is currently developing. Therefore, it's always important to go and check with your doctors what your symptoms actually mean for you. So all that being said, how do we then make sure that autoimmune conditions get detected early? I think from a patient's perspective, never underplay any of your symptoms and do not ignore the symptoms. You know your body best. If you have persistent symptoms or symptoms that typically last for a week or more, it is always important to let your doctors know or to seek help about that. Secondly, if you're unsure or if you don't get your answers, don't just stop at Dr. Google. Always speak to, again, a reliable medical practitioner who knows you and who will listen to you. From a medical perspective, for doctors, I think it is important that we listen to our patients and their concerns. When patients do present with symptoms such as persistent fatigue, tiredness, weakness, or joint aches and body aches, I think clinicians can perform tests that would help them assess these patients further for potential autoimmune conditions. There's actually new developments in this. I think, everybody's stressing about how difficult and rare autoimmune conditions are. But the good news is technology can help with that. AI algorithms are being developed and have been developed to help clinicians detect autoimmune conditions early. In Germany, a platform has already been rolled out to allow patients and general practitioners to actually fill in questionnaires about patients' symptoms to help them stratify for risk of autoimmune conditions. Locally, SingHealth has rolled out a chatbot to help patients use a symptom tracker to assess for risk of autoimmune conditions. There are also other applications that are being developed worldwide. In Japan, they have used the telehealth platform to help patients take photos of their joints to assess for rheumatoid arthritis. There are platforms used in Germany as well as in continental Europe to assess the risk of autoimmune conditions based on simple questionnaires that patients can answer. Who are worried about autoimmune conditions should see their GPs for initial evaluations. Their GPs then can actually decide on referrals to a specialist like a rheumatologist for further assessment and potential management of your autoimmune condition. So in conclusion, what shall we do? As a patient, I think always be proactive. If you have symptoms or you think you may have an autoimmune condition, go see your doctor. Ask them about the possibility of autoimmune conditions. Just because your symptoms are vague and just because autoimmune conditions are rare, does not mean that you may not have the condition. From a doctor's perspective, always keep an open mind. Never dismiss a patient's symptoms. Listen to them, evaluate them, and if need be, refer on further to the relevant specialists.